Good morning, good afternoon, and good evening. My name is Bernadette Daelmans, and I'm speaking to you from the World Health Organization in Geneva. I will talk about impact of air pollution, challenges and solutions to protect children's health and well-being. I like to start by reminding us about the Nurturing Care Framework. Its 5 components represent what young children need for their healthy growth and development: good health, adequate nutrition, safety and security, responsive care, and opportunities for early learning. Safety and security means protection from physical dangers, emotional stress, and environmental risks, including air pollution. There are multiple environmental risks affecting children's health and development, as is illustrated on this slide. So when we are thinking about the risk of air pollution, it's good to also remember other environmental risks and address them in policies and actions. The prenatal and early childhood period represent a window of special vulnerability for environmental toxins, and this applies also to air pollution. Young children's lungs are still developing, and air pollution can interfere with this biological process. Their bodies are less able to metabolize, detoxify, and excrete the toxicants contained in air pollution. Young children inhale more air per unit of body weight than adults, and they are more active and therefore breathe in more polluted air. Their brains are still developing, and neurotoxic compounds in air pollution can affect children's cognitive development. There are 2 forms of air pollution: ambient air pollution and indoor air pollution. In 2016, 93% of the world's children were estimated to live in places where ambient air pollution was above the WHO guideline limit, and the Southeast Asia and Western Pacific regions were much affected. Worldwide, 4.2 million deaths were attributable to ambient air pollution, of which 286,000 in children under 15 years of age. The consequences of exposure are grave. Babies born to women who were exposed to air pollution during their pregnancy are more likely to be premature or low birth weight. Exposure to ambient air pollution also increases infant mortality and leads to increased respiratory illness, including asthma. It affects development of the brain and increases the risk of childhood cancer. And because of these early negative impacts, there is increased risk of non-communicable disease along the life course. Household air pollution has been subject of less study and research than ambient air pollution. However, there is strong evidence that exposure to household air pollution increases the risk of adverse outcomes similar to those of ambient air pollution. An estimated 3.8 million people die prematurely every year from household air pollution, which mostly results from unsafe cooking devices and lamps that use kerosene and solid fuels such as wood or open fires in spaces that are poorly ventilated. Women and children are most affected by adverse effects, and household air pollution is estimated to be linked to almost half of all deaths from pneumonia in children under the age of 5, mostly in low and middle income countries. So what can we do about it? When considering ways to reduce ambient air pollution, individual level actions are not sufficient. The implementation of health-based air quality standards require policy actions from governments at the local, national, and global levels and around the world. This infographic presents ways to improve ambient air pollution. Improvement can be made by government investment in energy-efficient power generation, improved domestic industry and municipal waste management, building safe and affordable public transport system and pedestrian and cycle-friendly networks, making greener and more compact cities with energy-efficient buildings, providing universal access to clean and affordable fuels and technologies for cooking, heating and lighting, and reducing agricultural waste, incineration, forest fires, and certain agroforestry activities. We, as professionals and concerned stakeholders, have important roles to play. We can raise awareness, build collaboration with the affected communities, lobby governments to invest in ways to reduce ambient air pollution, conduct and publish research, and give attention to clean air when taking a pediatric history. When it comes to household air pollution, simple, effective, and affordable interventions are available to make a difference. The most important prevention measure is scaling up of cleaner household energy for cooking, heating, or lighting. Implementation of clean cooking solutions require a combination of measures aimed at use of fuel and technology that are considered clean for health. Government should restrict use of unprocessed coal as a household fuel and discourage the use of kerosene. They should improve energy-efficient household appliances, buildings, lighting, heating and cooling, encourage solar and wind-based electricity, and support installation of rooftop solar panels. Healthcare providers and other professionals caring for families can promote these cleaner technologies and support households to introduce them. The Clean Household Energy Solution Toolkit, or CHEST, supports the implementation of WHO guidelines for indoor air quality. CHEST is a suite of tools to help countries and stakeholders design, implement, and monitor policies addressing household energy. As mentioned, healthcare providers and other carers of families and children can do a lot to assist them in combating the effects of air pollution and work towards cleaner air. Here are some key messages to prevent both outdoor and indoor air pollution that are relevant for the general public. They include: stop burning household and agricultural waste. Think about how you can reduce your child's exposure to air pollution caused by vehicles. Keep your children healthy. Make sure they are up to date with their immunization. Have healthy diets and plenty of opportunity to play and be physically active. Monitor air pollution levels in the area that you live and know when and how to take protective measures. And raise awareness in your community and work together with relevant stakeholders to make improvements. For indoor air pollution, don't smoke indoors or near children, and ensure they remain supervised if they are open burning devices. Use cleaner fuels and technologies to cook, heat, and light your home. Choose electricity, natural gas, or other clean means. Use ultra-low emission stoves with processed solid foods if cleaner options are not available. And always cook in well-ventilated areas or outside if it's hard to ventilate the kitchen or cooking area. Avoid using kerosene lamps or stoves, and don't burn candle or use air fresheners, as these add toxic chemicals to the air. Many sectors need to be involved to tackle the burden of air pollution. The health sector has an important role to play. Frontline workers who care for children and their families have an opportunity to address air pollution by including guidance on safety and security and provide integrated services as part of primary health care. They can facilitate multi-sectoral collaboration and engage and empower communities to work towards clean air. In this vein, WHO, UNICEF, and partners are working on an expanded global agenda, bringing together the core components of the global strategy for women's, children's, and adolescents' health, the Nurturing Care Framework, and the Global Accelerated Action for the Health of the Adolescents under the umbrella of the SDGs. The comprehensive agenda for health and well-being of children and adolescents focuses on survive and thrive to transform health and human potential. It brings together essential interventions and supports well-care contacts to promote healthy growth and development in the first 2 decades of life. Tackling environmental threats is a core component of the comprehensive agenda. And as a member of the community concerned with childhood development, WHO recognizes the critical role that ARNEC is playing to promote clean, safe and secure environments for nurturing care. We look forward to continued collaboration and strong partnership to achieve the transformation that is needed to build a cleaner, more equitable and sustainable environment for all, and through that, provide a future for the world's children. With these words, I'd like to thank you for your attention.